So you have this rash here that's been here for a little while. Kind of, you get it every now and then, though, I think. Or maybe you've had it before, but we're gonna treat it and help you get rid of it, okay? And then we have this cute little blackhead. We'll get this all cleaned up. You have a little, almost like a little dilated pore minor here. Just putting a little numbing to make sure it's nice and numb. And then I'll make a little nick in it. You all right, huh? You're not gonna say anything, but you would yell if you would. And then I would dub it out that you were yelling. I'm just gonna push against you. There you go. You just relax your hand here a little. There you go. That helps because it's tense. Okay, a little bit. Pinch here. Just pinch. There we go. Oh, he's doing a little wiggle. Because then I think if we do that, we can take it from snap to snap. Let's try that. I'm new at that. So if you know how to do it, show me. Sure. You okay? No, you've given up. You've conceded. This will be, you know, if you had your numb in here, you could do this to yourself. You probably would have. But it's your right hand, it's your palm. This is driving you crazy because it's a pressure point for you, right? Whenever you push down on this, it hurts. And it's like it's a wart right under there. It's growing up. Oh no. It's a sensitive area, I'm sorry. We're trying to go nice and slow. Is it still kind of stinging right now?
A little bit.
Okay, it's that pinch, I know, that hurts the most.
When the pain gets too bad, I usually just pass out.
Don't say that. You're not gonna have, I've never passed out on my watch. Have you ever passed out for any other doctor?
No.
Okay. I was gonna be proud of myself if you had, and you haven't done it with me, see? You won't scream, right? And make everybody else frighten all the other patients.
I will not alarm your other clients.
Okay.
Patients.
You won't scare me either and make me lose years of my life, right? Some of my patients do that. Hey!
No, it just...
Don't do that!
It just fell off.
Scaring me! I got it. You made me think you did pass out. Trying to play tricks on me. Not hurting you anymore, right? Just feels pressure.
A little bit.
So there we go. We put some numb in there and it blanches the skin a little bit. But now we're gonna just see if we can't debride that a little bit. It's under there and it's pushing on him, and hopefully they'll get rid of it too. You can see that change, and that was good right there. Do you have do you think you do work on your hand that you develop a callus here or anything?
I beg your pardon?
Do you ever develop a callus here just by doing work? Do you do any kind of work where you're always leaning against this area?
No.
No, because that looks pretty good under here. Doesn't look like wart. If it was very superficial. So let's see if that won't help it.
It's just where the the butt of the club comes to.
Yeah, maybe you got a callus from playing golf and need to put one of those little pads. My tip is to put one of those callus remover pads with like a donut right there, so it won't push on the center.
I'll try it.
All right, here we go. We'll buzz it a little bit. You know that buzzer there? We're staring at it.
Admiring your work.
Yeah. Should put my little too bad the initial's not an O, then I can say my initial in it.
Oh,
Okay,
that's right.
we'll put a bandage on there. So you had much bigger ones at one point, and a little pinch here. You didn't even know you had them before, though. So, don't they bug you now when you see them starting to come back up? No. You're already been caught, right? You don't need to.
Right.
You're not on the market or anything.
Not yet.
So I'll know if that ever happens what's going on in your life if you actually ask me to take some of these out. It's like when you catch them wearing perfume or someone else's lipstick on their shirt. That's like this code.
Oh,
We got our eyes on you. Okay, you're not gonna get away from this. Right hand here too. Much less, so that's good. Just get this all cleaned up. I gotta get that one. One over there. One over here. And then good on that one. Actually, two of them. I can get that one. I can get this one. So you guys going on any trips soon?
No, we just finished a big trip.
And now you got to recuperate, huh? Yeah. Well, thank goodness that didn't happen on the trip. And what happened? Did you have to like get the ambulance in there and everything?
Yeah.
Come on.
They've got crews, first aid crews around the grounds, and then they take you back to the first aid station, and then.
Oh, so you got a one-on-one account of this. You need an article in the Times to write about this. What it's like to get taken back. Sorry, there's one really, really stubborn one. I'm trying to get it. All right, that's enough of that though. Let me get these two and then we're done. Okay, come on in closer here, and then these two on top. That one's kind of cute. This one here. Got some good ones here. You gotta stop letting these fill up so that, yeah.
Is there anything that he can do to prevent that?
You can use a little Retin-A, but I don't know if he's gonna do it. You're probably gonna have to sneak that on him when he's snoring at night. You know what I mean? It means he has to put like a cream on his face. I doubt. It's hard for me to even get him to put sunscreen. You know, you should mix it in with his sunscreen, maybe. And that's actually a joke. You know, it gets deactivated by the sun, so they have to use it at night anyways. So I don't know if he's gonna do that. And then I wouldn't have anything to pop. Good. Upper lid here to be able to do that. There'll be a pinch here. She said that she's now wants to have this removed. We've talked about it before because her little grandson goes 1, 2, 3 and counts the little bumps on her. I said, okay, now it's time. It's gonna raise this up here, and it's raised now. Sorry, you okay? Sorry about that. Let me just make sure this is. Gosh, guys. There we go. So we put a little numbing there just to make sure it's nice and lifted up, and then I'm going to. You okay? Okay. So I'm going to take that out flat. And then I'm going to buzz the base a little bit to see if we can't get rid of some of that pigment on the flat area. All my sniffles. Go. I'm gonna buzz a little more because I want to get some of those little blood vessels there. Good. That should be it. That should be maybe one more buzz. One more buzz. Good. All done. wanted to show how you know, lose reaction to the tape. You're irritated by it, so we're gonna fix that. And we have this area here that was a skin cancer, but as it healed, he has a little protuberance here. That's granulation tissue. So sometimes that happens when something's trying to heal. And if you scratch it with a little curette, it'll actually help it to heal better. I'm not surprised you don't feel this. It's almost like there's a little... I'm gonna take this off, make sure I'm not hurting you. Not hurting you?
No.
Isn't that amazing?
Oh.
That's pretty amazing that you don't feel that. But so what we'll usually do is we'll scratch this out. You make sure I'm not hurting you. We'll kind of scratch it out because it actually makes the, you're okay, right?
Yeah.
Makes the wound bed open again and exposed so that it will grow back up. It just, your body got too excited as it was trying to heal this area. It doesn't happen that much, but it definitely can happen, especially when you let a wound heal secondarily. You can see this whole area is kind of raised. You okay here?
Uh-huh.
I hope I'm not making you go backwards and start to bleed again here. Now this whole outside area that's irritated, I'm changing his bandages. He's irritated to the adhesive in the tape. So we're gonna switch it to something that you wrap your leg in and then just put what's called telfa, or the non-stick part of a Band-Aid on this area so it doesn't stick to the area.
Yeah,
But at
my
least it won't have
wife's been telling
adhesives.
me I should be doing that.
Yeah, and I'm actually gonna put some cream on you right now that'll help to like diminish that pretty much right away. It's just scar tissue here, but we'll send part of that in to confirm, okay?
So it shouldn't be getting that little bump, huh?
Yeah, sometimes it heals like that, that's all. I'm gonna grab something. Slowly, careful with my foot. Okay. A little buzzing noise you're gonna hear. Just buzz it a little bit so it won't. Once you walk around, it might bleed a little bit. So maybe with a telfa, you might want to put some gauze behind it. I don't know, you know, right behind it, and then wrap it. But before we do that, we're going to put some ointment. This is a little bit of ultraviolet ointment, which is a strong steroid. We'll put it not on the wound, but around it.
Okay.
Here, I'll do that right now for you too, because that'll help to make
I
that.
don't know whether I should be putting some kind of
That's okay.
cortisone.
We'll put
cortisone
antibiotic
or
ointment on
something.
top of it. This is cortisone. This is
Or-
a strong one. This will help to make that go away quicker, and I'll give you the rest of this tube since now it's yours. You can use it maybe once a day for the next few days just to see. Okay? There you go.